Knowledge is power, and so at the moment we don't know how many people in Australia even have haemochromatosis. We don't know the duration of their disease, and importantly, when they were diagnosed. So our focus is trying to get patients diagnosed early, and so without this data, we don't know how big the problem is, and we don't know how to solve it. Haemochromatosis is unique because it is a multi-system disease. So individuals may be treated by a number of different medical specialties and different kinds of doctors. And the risk of that is that we don't have a good way of collecting information from patients, and that's why the haemochromatosis register is really important, because it doesn't matter which doctor an individual is seeing. If an individual can join up to the register, we can capture that information and get an excellent snapshot across all individuals, and will allow us to improve the health outcomes of all patients with haemochromatosis. We need to know how many people have haemochromatosis. We need to know what age they're being diagnosed, because all of this comes back to the priority of early diagnosis. If we have early diagnosis, we have early treatment, which is safe and effective, and these patients will live a normal life. And what that will mean is that they will not develop end-stage complications from haemochromatosis, which obviously terrible news for the patient themselves, but also have a burden on the healthcare system in terms of cost. So we see the benefits at the individual level in somebody who has haemochromatosis, but also to the general population, because if this data is able to allow us to better study the condition, we can improve outcomes for individuals, and we can also improve the costs associated with providing healthcare. And so really everyone can benefit from this register.